Long time no see, YouTube family. It's been a whole month. I took November off, but I'm back. I'm back today with a popular topic, one that I get asked all the time, so we're gonna get into it. Today, we're gonna talk about if I call myself Dr. Bolt, or if I address myself as Dr. Bolt with patients or at the hospital, if I do or don't, why not, and kind of the information behind that, what the doctor title means. Let's get into that. It only makes sense that I'm drinking spicy chai tea today because we are spilling some spicy tea by even talking about this. This is one of the most controversial topics related to advanced practice providers, specifically advanced practice nurses. And I think that stems from the fact that for many years, a couple hundred years probably, nurses have always been seen as the assistants, the manual labor, the technicians, the people placing hands on patients and doing the caregiving, but a lot less, formal education. And then physicians have always been seen as the much higher formally educated, didactically educated people who were, the doctors. And they had, terminal degrees, at least in the last 100 or so years. And so this general idea that they are always what's referred to as a doctor, and a nurse is always referred to as a nurse and never a doctor. And there always have been like these two very clear dividing lines. And it's kind of funny because your allied health professions and other people who are highly educated in the hospital network and system, you'll talk to them and they'll oftentimes lament about the fact that they're always asked, are you a doctor or are you a nurse? And if they, if the default answer is if you're not the doctor, quote unquote, physician, you have to be the nurse. So physical therapist, pharmacist, audiologist, occupational, therapist, speech therapist, everybody pretty much, lab technicians, anyone who is not the physician is the nurse. And it just goes back to this old mentality that patients have, where they believe that everyone in the hospital is either the nurse who's giving them like the hands-on care, or they're the doctor who's writing the orders for the care, and that's it. So I think it's important to understand that's kind of where a lot of patients come from, at least they have in the past. Hopefully in the last 10 years we've made a lot of progress, but they kind of have that mentality, so you have to approach this topic with that mindset, that they really have two different dividing ideas of who people are in the hospital, and they put everyone in those two categories. So there's a very long-standing relationship and kind of just an expected team kind of environment between physician and nurse. And the way that it gets complicated is nursing in the last 30, 40 years or so has really started to up its education to levels that it never was before. Formal education, didactic education, expectations of sciences and research and being involved in leadership and being involved in healthcare as a whole, like in the C-suite and way beyond bedside. And nursing in America is unlike nursing in pretty much any other country I've ever been to or heard about. In America, nurses are seen as the backbone of the hospital, not just physical labor wise, but leadership wise, management wise. The macro view of the hospital and how it's functioning and flowing is many times dictated by nurses. We are one of the only countries that has quite a few masters and doctorally trained nurses who have gone on to school and done a lot more education. We're also one of the only countries in the world where you have quite a few advanced practice nurses with masters and doctorates who clinically practice in a very similar, if not the same type of fashion that a lot of physician specialties practice within. We are also probably the only, if not one of the only countries in the world where advanced practice nurses can practice independently on their own because of our education and our history of safety and how much training we do. So you give all that context to the story, and then you say, all right, so now you're an advanced practice nurse. You have a doctorate degree, which gives you the title of doctor, but we don't want you to use your title because people will confuse that with a physician. And you have quite a few physicians that have a very strong opinion on nurse practitioners or CRNAs who have our doctorates not ever using our title or speaking about our title or our education levels. And you wonder why. Well, I mean, our backgrounds have always been a teamwork. We've always had this identity of nurse and doctor, and two very different education levels and abilities, and one is very much in charge and leading the pack versus the other, and one has a title and the other has the title of nurse, and that's it. No other educational title beyond that. It's kind of a newer thing, this concept of us suddenly not just having all of us in this, one has the nurse title only and one has the doctor title only, and it's a very clear division. Now you start having nurses who are also nurses but also have their doctorate title, and they also can practice independently, and they also provide all of these services that physicians also provide. And there's a lot of fear on certain sides of this of people crossing over and what they like to call scope creep, where you're maybe invading on what they feel like is their territory only. Drives a strong reaction to people having these titles. Now, then you move on to the topic of, beyond the providers having opinions on the titles, you move to actual patients. What do the patients think? What are the patients, are the patients confused? Because you certainly never want to misrepresent yourself. As a CRNA, I would never want to misrepresent myself to a patient and have them believe that I'm a physician. One, because I'm not, but two, because I'm very proud of my doctorate in nursing practice in anesthesiology, and I'm very proud of my background in the ICU as an RN, and my time in nursing school and undergrad, and all the things that I've done in my life and career. And that's a very different path from what a physician anesthesiologist takes. So I would want them to know my path and what I took. I'm very proud of that. I obviously talk about it online all the time. So I want them to know who I am very clearly. But I also am not going to not tell them who I am so that I don't overshadow or seem like I'm encroaching on someone else's space because they don't like the path that I took, or they don't like that I have a doctorate in nurse anesthesiology. You kind of hit a crossroads, and then you start wondering, so you should talk to your patients, educate them on who you are and your background, because they deserve to know. But you also don't want to be seen as trying to misrepresent anyone. Anytime I use my title, which, to be completely frank, I don't use it much. I personally, when I first got my doctorate and I graduated, everyone called me Dr. Bolt, my family. It was on my cake, my graduation cake. It's on, I have my doctorate on my wall behind me here. I'm very proud of it, and I was, enthused in the beginning, and I have it on my lab coat and things like this. But after 200 times of someone calling you Dr. Bolt, it kind of loses its excitement, and you realize it's kind of just a title. Like, it doesn't really change anything, whether someone calls me Jason or Jason Bolt or Dr. Jason Bolt or Dr. Bolt. It doesn't change who I am or how I practice or anything about my life. So it kind of loses its luster, and then you realize, you know what? I actually kind of like people calling me Jason. I like patients calling me Jason. I think that it adds, especially in anesthesia, I find that when I come and sit down with you and I tell you, hey, nice to meet you, I'm gonna be your anesthesia provider for the next, how many hours, and I'm gonna be with you in some of the, most critical moments of your life, and I'm gonna be your guardian angel watching out for you over this whole case to make sure you're safe and taken care of. I want to be on a closer relationship with them. I want them to feel connected to me. I want to call them by their first name too. I don't really want to call them Mr. Smith. I want to call him John. I want John to know that I'm going to be with him and I'm going to take care of him, and I'm Jason, and we're just two people, and I'm here trained in anesthesia, and I'm the person that's going to be there for you throughout this process. And if you need something simple like me to hold your hand because you're scared when you go off to sleep, I'll do that. If you just want to feel connected to me and have a close interpersonal relationship with me in that moment so that you feel connected and you feel safe and taken care of, I want that too. I don't want there to be this division and barrier. So realistically, I don't use the title. I don't really use it with staff either. I don't think the nurses and scrub techs and everybody else should need to refer to me by my last name and a title. I really don't think that that's necessary. I find that they all respect me quite a bit without me demanding a title be used. And I think that actually the providers, physicians included, that usually insist on using their title a very old-timey kind of way, I think staff kind of regard them in a certain way, and it's not a way that I would want to be regarded. I think that's just the way healthcare is moving, and I think you see that a lot from the younger physicians who choose not to use their title all the time, or it's rare for them to, answer the phone using their title or something. So I hope to see that more often. That's kind of the way that I live my life. That's kind of my idea and the background on the doctor versus nurse versus using your title. I do want to be clear to you though that you should always, and it is illegal to impersonate a physician in any state. So when you do use your title, you do need to specify. If I say I'm Dr. Jason Bolt, I'm your CRNA, nurse anesthetist or whatever, you need to specify your title and what type of doctor you are. Same for pharmacists, same for physical therapists, same for dentists. Anyone who has a doctoral title needs to be specific, especially in a clinical setting, so the patients have a good understanding, like what kind of doctor are you and what are you doing for me today? Everyone should really be doing that. Even if you're a physician, you should be saying, I'm Dr. whatever, I'm going to be your medical doctor who's offering cardiology services for you. These are things that you should be specific on. So that's my thoughts on doctor versus not doctor, advanced practice nurses using their title or not. If you want to use it, be specific on who you are and what you're doing for that patient, and make sure and answer their questions, educate them. Some people say, oh, well, they don't understand, you educate them. I mean, patients are not foolish, they can be educated. It's insulting to insinuate that patients cannot grasp a concept that you have a doctoral degree and you're a nurse practitioner. That those are not mutually exclusive concepts. So you should be educating your patients on these things, and you should definitely not be hiding your education and your background in order to make someone else who's a different provider feel comfortable about it, because they don't like the idea that they think you're encroaching on them. Everyone who has earned a degree or title, they're not encroaching on anyone. They're just doing what they're trained and licensed to do. But I want to hear from you guys down below what you think about it. A lot of you probably don't have your doctorate, so maybe if you don't have your doctorate, you're thinking about the idea abstractly, like one day if you get that degree, what you would like to be called or not called, or what your thoughts are. It kind of changes a little bit once you actually go through all the work to get your degree, and then you kind of look back and you say, okay, now I have an idea of how much work I just went through to actually get this degree, and now do I want to use the title or not use the title? It's a lot easier when you've not gone through the work yet to declare, oh, I would never use the title, or I'm just a nurse or whatever. But then once you go through all the work and actually achieve it, it's a little bit different, I have to say. But I want to hear from you guys down below what you think, and make sure and hit the subscribe button. If you have not hit the like button, what are you doing? If you want to join the memberships on the channel, like the Ketamine Kings and the SIBO Surfers and the Propofol Pros, they get the 26-page study guide. They get live chats every month with me. They get special shout outs in the videos. So if you want to do that, join the channel's memberships. There's a tab over here to do that. Last thing I want to plug is a new Patreon that me and a couple of my friends on Instagram have launched. It's me and Rob Uronium and Rihanna Fariel, who a lot of you guys know here on YouTube, and Raquel Roberts. We're all four mostly on Instagram. Some of us, like me and Rihanna, are on YouTube too. But we've opened up a Patreon in a Discord channel for forums for all of you guys who are just want to talk about topics about CRNA stuff, trying to get into school, whatever it is you want to chat about. We have a Patreon, so I'll probably link it down below so you guys can find it. Go over there, hang out with us over there if you want, and until next week, that's Bolt out.